Well, flu season is upon us again, and for many that means it's time to get the flu shot. But a delay in the distribution of the vaccine this year means some patients will have to wait. Now, part of the reason for the delay stems from the World Health Organization because the WHO took longer to identify this year's influenza strain. What that means is that in places like Ontario, healthcare providers are being told their main supply of vaccines will arrive sometime in the coming weeks. And for a closer look at what this means for you, we're now joined by Dr. Samir Gupta, a respirologist, also an associate professor in the Department of Medicine at the University of Toronto. So, Dr. Gupta, thank you for joining us. Thanks. So let's start here. Let's start with the delays. As we said, part of it has to do with the WHO, as they were trying to identify the relevant strain this time around. Yeah. Are there any other reasons for this delay?
Yeah, so if most of the delay is just accounted for by, as you say, the complexity of figuring out which strain should be covered every year in the flu vaccine. So the way this works is that, we have experts from the World Health Organization, and they meet a couple of times a year, and they look at surveillance data from flu cases from around the world, and they use that to try to predict, what we're going to see in the next flu season. The problem is that, it takes about 6 months to manufacture the vaccine. Mm-hmm. So for this flu season, which is now, they actually met in February to try to make those decisions. And what was happening in February is a little bit unusual this year in that the strain that we were seeing and causing disease in the US was different than the strain that was causing problems in Canada and Europe. And that was a little bit unusual. Mm-hmm. So they opted to actually observe a little longer. They waited an extra month to try to figure out what the right one was. And as a result of that, the decision was made in March, and that pushed down the manufacturing. Okay,
so pushed down the manufacturing. But those that have already gotten the flu shot, the last couple of weeks, is that shot still relevant then to this year's strains of influenza?
Yeah, it is. And so the shot that's out there is going to be the same shot whether you got it last month or you get it, in 2 months from now. But there is this question around, people are talking about, should people be getting the shot a little bit later? And so the way
and I guess the argument on that is if you get it too soon, it won't be effective when the flu season's at its worst.
Right, and that's a relatively new sort of thing that's come out in the scientific literature. The way that the shot works is that it stimulates our immune system to create antibodies against proteins in the flu virus. And so if you're then exposed to the flu virus, those antibodies will protect you. The problem is that antibodies don't last forever. So older studies suggested that, probably people have decent antibody levels up to 6 months after getting the shot that are probably protective. But now we have newer studies in the last couple of years, so one this year and one in 2017, that suggest that your chances of getting the flu are a little bit higher with each passing month after you get the shot. So this does suggest that there's some, what we call waning immunity. The effectiveness of these antibodies might be less. And as a result of that, people are advocating for getting the shot a little bit later. The flu season will peak between December and March. So this would be a very good time to get it. Mm-hmm. There's a practical issue too, though. We don't want people to not get it just because they're trying to perfect the timing. So, the patients that I've been seeing in my respiratory clinic, I've been giving them the shot throughout October because that's an opportunity to just get it done and make sure they get it.
Mm-hmm. So better some than no protection whatsoever.
Right, absolutely.
Do we have any idea at this point how bad the flu season ahead is actually going to be? Can we say that?
Yeah, that's always a question we get and we think about. We won't know that until we know what strains are circulating and how those strains are affecting people. And really, it's a bit early. So, we're worried about it. I was on call last week and we isolated 5 different people for the flu, but we're just not seeing a lot of confirmed cases. So far, our Canadian surveillance data suggests that we are still at under 100 cases a week, which is low. And so what we generally do is we look at the Southern Hemisphere and what they've had is what's coming. Australia had a very fast start to their flu season. We haven't seen that. They had a lot of deaths, so there is that concern. We also know that one of the strains that will be circulating is called H3N2. That one can be particularly virulent, can cause more complications and more deaths, so that's something we're wary of. Also, as it turns out, despite the delay in the decision, the strain that was chosen by the World Health Organization, the H3N2 strain that's covered in the vaccine, is not the same one that ended up being seen in the Southern Hemisphere. So there is this possibility of a mismatch with respect to the H3N2 that might be circulating in the population compared to what's actually covered in the vaccine.
Okay, let's go back to that then. So if there's a mismatch, can we say anything about the efficacy of the vaccine that people are going to be getting this season?
Yeah, so it's important to recognize that, we have a quadrivalent vaccine, which means that it covers for 4 different strains. So one of these strains may not be perfectly matched, but there's still protection for the other strains. The other thing to keep in mind is that even if it's not a perfect match, it might mean, typically the flu vaccine effectiveness is about 50%, but it still means that if you catch the flu, you will have less severe of an illness. So that means you'll be sick for a lower duration of time, and you have a lower chance of being hospitalized or dying from the flu. So even if you catch it, you'll be less sick from it if the match is not perfect.
And are you then also less likely to pass it on to someone who may be one of the more vulnerable, in a vulnerable group?
I mean, if you catch the flu, you are contagious. But if you've had the shot and the duration of illness is shorter, there's a possibility that your duration of being contagious, that period where you're contagious, is also going to be shorter.
Okay. Before you go, there's always this debate out there. People think, oh, I'm busy. I don't have time to get the flu shot. Or they just don't even believe in the flu shot. What do you say to those types of skeptics?
Well, we always turn to what we know from science. We have, in this country, the rates have gone up in the last few years. 42% of people got the flu shot last year. I have patients who sort of say, I've had a bad experience with the shot. I got the shot and then I caught a cold. But the reality is there are a lot of colds circulating at this time of year, and that's just a matter of chance. People happen to catch a cold and they blamed it on the shot. We have massive studies that look at the difference between getting a placebo as a shot and getting the flu shot, and they clearly demonstrate that this does not cause people to get colds, but rather reduces the chances of people ending up really sick, so ending up in hospital, and in many cases ending up dying. So hundreds of people still die from the flu every year in this country, and thousands of people end up in hospital, and particularly people who are vulnerable, people with weak immune systems, the very young, the very old, people with respiratory conditions. And so there's this concept of herd immunity, whereby even if you're not going to get very sick from the flu, or if you say, oh, I've never had the flu, there is a chance you catch it. But even more importantly, there's an onus on all of us to protect those of us who are vulnerable to getting really sick from the flu. So really all important to keep getting that flu shot every year.
Dr. Samir Gupta, thank you for that.
Thank you for having me.
And Dr. Gupta is a respirologist, also an associate professor in the Department of Medicine at the University of Toronto. And for more on what you should know about this flu season and to get additional information about the vaccine, you can visit canada.ca/flu.